Welcome. My name is Peter Strong. I'm a professional psychotherapist specializing in online mindfulness therapy, which I offer via Skype for the treatment of anxiety disorders, including obsessive compulsive disorder, or OCD. If you're looking for online therapy for OCD, then I invite you to go to my website and contact me if you have any questions about the mindfulness therapy program that I teach online via Skype. Whenever you are looking for online therapy, and a lot of people prefer online therapy these days because it's so convenient and it also gives you greater access to therapists like myself who specialize in mindfulness therapy or cognitive behavioral therapy. Whenever you're selecting an online therapist, do make sure that the therapist offers therapy via Skype. It's very important that you see each other. If you can see each other, then there's no difference in the effectiveness of online therapy by Skype compared to therapy in person. But you do need to be able to see each other. So in the mindfulness therapy approach, our focus is on helping you fundamentally change the way that you relate to those intrusive thoughts, those obsessive thoughts that trigger unwanted repetitive behaviors in the compulsive aspect of OCD, and that also cause a great deal of suffering, emotional suffering. Many of my clients that I have worked with over the years struggle with intrusive thoughts. Sometimes they are thoughts related to a phobia, such as a phobia of infection, a germ phobia that leads to obsessive hand washing, or it could be a whole range of thoughts. But the characteristic of intrusive thoughts is that they persist, they're very intense, and they stay in the mind and keep coming back into the mind over and over again. So the first question you need to understand and explore is what is it that causes a thought to be intrusive? Well, a thought becomes intrusive when it has a very high emotional charge. So it's the emotional charge that causes obsessive, intrusive thoughts and obsessive thinking and obsessive worrying. It's the emotional charge that's the important thing. It's not the thought itself. It's not the content of the thought. It's not the story behind the thought. It's the emotional charge. And in the case of OCD, that is most typically fear. So the underlying fear is what keeps those thoughts active and causes them to replay themselves in the mind. So if we want to overcome OCD, then we must work with that fear. Not so much the thoughts, but the fear that fuels those thoughts. When you neutralize that fear, the thoughts will tend to disappear by themselves. They cease to be relevant, and they are processed in the same way that the mind processes hundreds of or thousands of thoughts during the course of a day. It's the fear that keeps them alive. So working with this emotional charge of fear is very much at the heart of mindfulness therapy. And the way we do that is by learning to meditate on those thoughts and the fear underneath the thoughts. Instead of trying to avoid the thoughts or suppress them, which will not be effective. We actually develop a conscious, mindful relationship with that fear. You must make your focus about healing that fear. So we do that by developing a conscious relationship, first of all, in which we are able to observe the fear and its thoughts without becoming identified with the fear and its associated thoughts. When you become identified with the fear, then the fear controls you. But when you're not identified with the fear, then the fear is reduced to what it actually is, which is an object, a mental object. So cultivating a mindful relationship with the fear means that we are learning to see the fear objectively as an object in the mind, instead of becoming that fear. So the only way to do that effectively is to meditate on the fear, because meditation is the process of cultivating a fully conscious and non-reactive relationship with whatever it is you're meditating on. In this case, we meditate on the fear because we want to break free from that habit of reactive identification which feeds the fear. So that's a very important part of the mindfulness training that I will be teaching you during our therapy sessions together if you choose to work with me. There are other aspects, of course, that we have to look at in OCD. So working with the underlying emotions that are fueling the obsessive thinking and compulsive behaviors is central. But we also need to look at ways of managing the compulsive aspect. That is where that fear is converted into repetitive behaviors like hand washing. So there we need to learn how to manage that impulse itself. So we use mindfulness to develop an objective relationship with the impulse so that we can see it separately as an object and not become overwhelmed by it. This is the same principle that we have to apply when we're working with addiction. We have to learn how to break free from becoming controlled by that impulse. So if you'd like to learn more about mindfulness therapy for OCD, and you like the idea of online therapy for the treatment of OCD, then do reach out to me and ask any questions you may have about this process, and we can go ahead and schedule your first Skype therapy session for your obsessive compulsive disorder or problem with intrusive thoughts. The mindfulness therapy approach is very effective. Most people see tremendous improvements in a relatively short time. I have worked with people who have suffered from intrusive thoughts for years, and it's really affected the quality of their life dramatically. And within 3 or 4 sessions, they begin to see a way out from this nightmare, which is how obsessive thoughts, intrusive thoughts are often experienced. It's like a nightmare. It's terrible, terribly painful. So it is possible to change, and really quite quickly, once you learn how to work with your emotions, the fear primarily, and with thoughts, and with emotional impulses using mindfulness. The medications I don't recommend for treating OCD because, of course, medications do nothing to change the underlying psychological process that's producing your OCD. You must learn how to break free from reactive identification and then promote the healing of that fear. When you develop a conscious relationship with that fear, it will heal. If you feed it with reactivity, including the acting out the particular compulsion, that will simply feed that underlying fear. But when you change your relationship to one that's based on mindfulness, and with mindfulness comes compassion, then you'll start to see rapid healing from OCD. So if you'd like to learn more about how to recover from OCD using mindfulness, then please contact me. Thank you.